Module 27 is on grief and loss. Some definitions: loss, something or something, someone of value, is inaccessible or dramatically changed. It's an actual loss, anticipatory loss, or perceived loss. You know, when we talked about personality disorders, we talked about their perception of it. It wasn't an actual, but it can be an actual. Anticipatory loss is something we'll talk about as part of like their bereavement process. Bereavement is a response to a person's death. Grief is a combination of psychological, biological, and behavioral response to a loss. Mourning is processing and a resolution of grief through beliefs and practices. So this perceived loss, you feel a loss, but it's not something somebody from the outside can see. So types of grief, page 184, 1884 and 1885, and page 1892 talks about different types of grief. Your anticipatory is experienced before the actual event, preparing for your own death or the death of a loved one. Could complete the grieving process before the death actually occurs. Can also lead to detachment of family members and cause isolation and loneliness for somebody that is terminal. Disenfranchised is a person cannot acknowledge the loss to others. That's examples are having an affair, a lifestyle cause such as suicide or drug overdose, or an abortion. It's a type of grief. It's so the person doing this. So if you're having an affair, it's a certain lifestyle you're living, or that you don't want to feel like you can't go and tell people. And then also, or if you're the victim of somebody that you know they're having an affair, if your parent, spouse, something of somebody that died from suicide, overdose. Women have disenfranchised grief when they've had an abortion. There's a lot of psychological stuff that goes with it that they do not talk about. Complicated grief is unable to resolve the grief. It impacts their daily living. It is not diagnosed until 6 months after loss. If 6 months after loss, the grief has not resolved, it is called a complicated grief. 6 months. Stages of grief. Do you know that denial is the first stage of grief? No, it isn't. How could you even say that? I suppose you might be right. I'm such an idiot. Are you all right? Okay, page 1885. 1885. I'm looking for it on 1885. Anyway, the nurse provides a safe, non-judgmental place to grieve. Do not give false hope. That is very, very important in your answers. Listen, allow them to speak. Nurses must understand to guide people through the process. So the stages are denial, which is not accepting the loss, generally occurs for a short time. Anger, mad at people around them. Right there. Denial, anger. Bargaining, making a deal with a higher power. This is your bargain. I suppose you might be right. Depression, profound sense of deep and penetrating loss. There's all the tears. Acceptance, free from anger and depression, almost lacking emotions. Manifestations of grief, also on down the bottom of page 1885, can be emotional. It can evidence itself emotionally and physical. Emotional, shocked, stunned, sad, desolate, afraid, lonely, let down, overwhelmed, helpless, regretful, angry, guilty. Where physical, crying, moaning, agitated, exhausted, sleeping changes, dry mouth, tight chest, stomach ache, digestive, somatic symptoms. usually dissipate over 3 to 6 months. Remember, it's complicated grief when it's past the 6-month mark. May resurface on certain days, like an anniversary, a birthday, a holiday, a family time, where all of a sudden they're feeling the grief again. Another death. Complicated is unresolved and interferes with life. Those are the two. More than 6 months, it's unresolved, and then it interferes with their life. Could lead to prolonged grief reaction, can actually get worse over time, could even just be due to inability to accept the loss. My younger son's best friend died at age 17 from cancer, complications of chemotherapy, and this happened within a short time, 6 months, 8 months of my son's death. So this mother called me probably 6 months after her son died for me to help her. And to this day, I mean, it's been 11 years for me, 10 years for her. And she is such an angry woman. She's not the woman I know. She is the complicated grief. She spits out at people, and it's sad. Okay. Disenfranchised grief. Talked about the complications, anticipatory of disenfranchised grief. Sometimes we grieve things that others people cannot understand. I just thought this was a good picture on helping on disenfranchised. 1888 has a little graph where it compares disenfranchised grief with complicated grief. Disenfranchised, the result of being unable to acknowledge the loss to others, whether it's not socially acceptable or whatever it is. Hiding from others as opposed to allowing support from friends, not seeking support for whatever reason, whether it's guilt or feeling shameful. Intensified emotions associated with grief as opposed to those found in normal grief. More pronounced feelings of anger and depression due to resentment because they can't acknowledge the loss for whatever reason. Help is support groups recognizing a patient's right to grieve and address spiritual and cultural needs. So suppose a person is involved in an affair. They're having an affair with a married man. That man dies. They can't tell people they had this loss. They said abortion's another, or maybe they're in a same-sex relationship, or whatever the relationship is, whatever it is, or their child overdose, something that society looks down on and they cannot feel comfortable coming out. That's disenfranchised. Complicated grief that is unseen, hidden away, or misunderstood, does not receive the support it needs. Pay close attention. Prolonged or intensified grief causing individuals to be unable to proceed with the grieving process. More than 6 months, inability to process it. They can have vision. They don't have to, but they may have visual or auditory hallucinations of the individual died. It's not letting go of that person. Growing distrust of friends and family members. Avoiding places associated with the memories, intense feelings of depression, and accompanied by suicidal thoughts or tendencies. It doesn't have to be all of these, but these are some of the things. So management, could be due to inability to accept it. The nurse needs to provide a safe, non-judgmental place to grieve. Psychotherapy for talk therapy. Watch for suicidal ideation. Watch for alcohol or substance use due to their poor coping. They would do well with cognitive behavior therapy or CBT. Join bereavement group or social services. They need to ask for help. Cumulative loss, page 1886. I liked this because when it rains, it pours. It's cumulative. It just often in the older population, they can have a cumulative loss. It's several losses in a short time. Person can become paralyzed with grief. Need to assist with healthy coping. Traumatic loss can lead to PTSD, a greater risk if PTSD already exists. In the older patient, they may be losing their spouse that's been there forever, along with some of their friends. They may be losing their independence due to their health, their family, their children have moved away, multiple accumulation of losses. Assessment. Observation. Taking a patient interview of their loss in the grief, their loss, previous losses and frequency, assess their risk, elderly more likely to have numerous losses, and assess their grief, current and past grief reactions, how have they dealt with things in the past, how are they dealing now, the nature of the loss that's causing the grief, physical exam, family functioning, impact, support, needs, how loss is perceived, the expression, each member's health status, and their spiritual or cultural. This is on 1890 and 91. Observation and patient interview has all your steps for you. Grief and loss assessment, there's a whole chart on page 1891. Your loss assessment and your grief assessment, what you're looking for, what the normal findings are, what the abnormal findings are, and what you should take into consideration across the lifespan, such as the top of the loss assessment. Children are likely to process losses differently than adults. It should not be assumed that they do not understand the loss because of their age. They just process it differently. Older adults are likely to develop numerous losses over their lifetime, and these can become cumulative. They don't have to be just in a short time. Grief assessment, children and older adults are at a high risk for complicated grief. Older adults are at high risk for depression, loss of a spouse or caregiver may impact independence and require additional assessment and referral. Independent interventions, page 1892, lists them. I have them pulled out here. Therapeutic communication, listening techniques. Don't keep trying to answer, just be listening. Open-ended questions, prompting, tell me more. Body language, not crossing your arms, not looking angry, being relaxed, open body language. Teach the grieving process, discuss forms of therapy, warning signs of depression, healthy coping, availability of resources. And remember, with the grieving process, we don't go 1, 2, 3, 4, 5 through the stages. We can go back and forth and around, and it becomes complicated when they can't proceed. Be attentive, non-judgmental, judgment-free. Encourage them to share their feelings and their fears. This is 1892. Children tasks grieving, page 1895. Developmental stages, the grieving process through the different ages. Accept the permanence of the loss, experience the emotions, adjust to daily life without the lost person, memories in place of the person. Loss of a family member, childhood friend, mentor, or pet, loss of relationship with parent due to divorce, loss of support system with relocation, multiple things. So if you look on here, I'm going to expand on this a little bit. You have age loss, page 2 to 4. This is on 1895 through 1898. I've broken it up for you to make it easier. Age 2 to 4 cannot fully comprehend, but they know something's different. Can lead to changes in their eating, sleeping, possible regression going backwards. This is in the toddler age, will regress. Lost interest in normal activities, clinging, needing additional attention. What you need to do is maintain their normal routine, give them extra assurance and attention, honest answers. Don't fudge. Tell them the truth. Age 5 to 7, this is the young school age, still view death as reversible. They have magical thinking. They feel guilty. They're in their magical world. If you remember your Erikson and Piaget. Death is another place. This magical thinking, they could feel guilty or blame themselves, think they're somehow responsible. This is not just death, but if it's death of a marriage, it's divorce, can be to a child, that is a significant loss. Be honest. They may act as if nothing's happened. They have changes in the eating and sleeping. They may have nightmares. Be honest with them. Allow expression through art, drawing, play, acting. They can compartmentalize, and this helps them express themselves in other ways. They need assurance of safety and well-being. Still on page 1895, you have H8 to 11 on the bottom, going into 1896. They begin to understand that death is permanent, believe their thoughts could cause the loss. They act out in aggression, misbehaving, withdrawing. Children can compartmentalize and find ways of expression, and this is in these behaviors here. Help them with scrapbooking, memory box, bereavement groups, and they may want to write out their feelings, write stories, write a journal. Page 1895, you get into age 12 to 18. The adolescent response of the adolescent is comparable to the adult. They get depression, denial, anger, often anger toward the parents. Encourage them to voice their feelings, verbal and or in writing, in therapeutic writing, allowed to share with their peers. There is a high risk of substance abuse due to the grief response. Always remember cultural expectations, and parents make the final decision. You can make recommendations, but the parents make that decision. Dying child. Yes, the parents are grieving here, but the child is also the one losing too. Provide pain medication, involve the parents, offer spiritual or cultural resources, encourage questions, educate the parents about signs of impending death, educate about normal coping mechanisms, assist the parents to find meaning in their death. This is on page 1899, I think. Trying to find it in here. Okay. Caring for parents in fetal demise, assess spiritual needs, encourage questions, allow parents to process their grief. That's huge there. Allow them to process this. Just because it's obvious to you, they have to process it. Mother decides birthing preference and who is to be present. That's the mother's decision on page 1903. There's a perinatal loss chart. It can be miscarriage, placental abrupta, DIC resulting in retained fetus. Clinical therapies over here, look at those. I don't know how much that was covered in your OB, so I may touch on it briefly. Loss in older adults, loss of independence, mobility, health, memory, home, loved ones, friends, cumulative loss can lead to isolation, depression. There's a high suicide risk in age 65 to 74. Very likely due to this cumulative loss. They will do well with group therapy. They can have complicated grief and go to complicated grief therapy support groups. Although the current loss may not seem significant, it's a piling accumulation. They may not share their pain and their sadness. So 1904, let me see. Older adults starts on page 1903. The source of their losses. Safety alert, suicide in older adults on page 1904 is commonly a result of untreated depression. In the past, the chronic underdiagnosis of minor depression in older adults led to higher suicide rates, especially in men. Nurses in all settings should assess for signs of depression, even if it appears minor, and assess for increased risk of suicide. Your clinical manifestations, withdrawing from everything, maybe somatic, decreasing in their care of their body, giving things away. Look at your patient history. Focus on diversity and culture on page 1905. Loss among older adults, read over that. Non-pharmacological therapy. Treatment of grief in older adults can be successful without medications through group therapy, cognitive behavior therapy, some kind of support group. There's a really good care plan in 1906, loss of a parent by a pediatric patient. So remember, the children can lose a parent to death or other things, and this is just a good care plan for you. And that is the end of this recording.